Hello, my name is Casey Reed. I was the nurse today on day shift on the med-surg floor. I will be giving you a report on Miss Susan Clark. She is in room 101. She is our 55-year-old patient who underwent a bowel resection 2 days ago. She is alert and oriented ×4. She had a transverse colostomy created and is in the early stages of care and management of the ostomy. She is having some abdominal pain, but I did not witness any signs of infection at the surgical site. She is having some anxiety about changing the ostomy bag, but does understand the basics of ostomy care. So far, no history of skin issues around the stoma, and she has a history of colorectal cancer. Upon my assessment of her stoma, it was beefy and red. It looked very good. I measured for any size change, which there wasn't any. I checked for bleeding and irritation. Everything looked great. No color change of the stoma or of the drainage, and there's also no prolapse, and perfusion obviously looks good because the stoma is red and beefy. I'm recommending a follow-up of the ostomy care and possibly a teach-back session so that she feels more comfortable with her changing her ostomy bag. I would also recommend a consult for a dietitian and nutritionist, seeing as how that is a big lifestyle change going from no stoma to stoma. Since she is feeling nervous, I would also contact a social worker for possible ostomy support groups to help her feel more comfortable as far as living with an ostomy in normal day-to-day life. I'm going to go ahead and answer the assessment questions. A was what immediate nursing assessment should be performed for Susan upon first interaction. I chose stoma skin assessment, checking for any difference or changes in the stoma, such as the size, color, also a drainage assessment to see if there's any change in odor or if there's discharge like pus or blood. For color, we are obviously looking for red, beefy. Any change in color, such as black or purple, would mean compromised blood flow or possible necrosis. What else? Oh yes, I would also evaluate self-esteem, body image, and quality of life because she is nervous about having the new ostomy bag. For the second question, how would you assess Susan's stoma and peristomal skin for any complications or abnormalities? Of course, we're checking for color. Should be beefy red, any discoloration. I just explained that, sorry. So we will move on to C, discuss the key points of education you will provide to Susan about caring for her ostomy. The key points that I chose were using the correct pouch and skin barrier opening. If it's too small, it can injure the stoma or cause swelling. If it's too large, it can cause skin irritation around the stoma. Also, another key point would be the diet. For the first few weeks, you want it bland, low fiber, easy to digest. This will help to avoid any uncomfortable symptoms like bloating, gas, or diarrhea. Tell her to choose 6 small meals a day instead of 3 large ones. Drink at least 2 liters of water a day or 2 liters of fluid. Add foods slowly back into your diet that you would normally eat and introduce one at a time. Also, hygiene is a huge key point. Making sure you are only cleaning with water when it comes to the stoma and not any kind of soap. And lifestyle, tell her just not to worry. Don't let having this new situation get the best of you. Perhaps speaking with others with ostomies would help. Telling her that she can return to her normal activities as soon as the doctor allows, as long as it's nothing aggressive, like hands-on. Moving on to D, outline the steps for performing an ostomy bag change for Susan. Consider both technique and the patient's comfort. So, first we would gather our supplies that we would need, such as plastic bags, washcloths, wipes, the new pouch, new barrier, extra skin protectant scissors, and a clean towel or two. Then you would wash your hands, empty the contents of the bag, wash your hands once again, and then starting at the upper edge of the skin barrier, we carefully push skin away from the skin barrier with one hand and peel the skin barrier with the other. Once the seal is removed, we obviously put it in a trash bag and move on. We will wipe away any stool off of the skin around the stoma, clean with warm water and a soft washcloth. Wash to the edge of the stoma, pat dry with a clean towel. If needed, apply extra skin protection like moisture barrier cream or powder. Cut the new barrier no more than 1/8 of an inch bigger than the stoma. We are pulling the backing off of the skin barrier and carefully placing it over the stoma. We next move to applying the pouch by starting from the bottom and working your way around the flange. We press the barrier against the skin with your hand over the barrier and hold that down for 45 seconds. This will help mold the barrier to the skin. If we are using a drainable pouch, we will clamp the tail. And that pretty much sums it up. Then, of course, we wash our hands again, and we're all done with that. E, what are the potential complications related to ostomy care that you should be aware of? And how would you intervene if these complications were suspected? So, potential complications related to ostomy care would be, of course, getting some type of infection into your bloodstream, which can kill you. So, always making sure that we are washing our hands before we are changing anything is extremely important. How would we intervene if this complication were to come up? You would probably have to be hospitalized once again and probably get on some high-powered antibiotics to get that infection out of your blood. F, considering the emotional aspects of ostomy care, how would you approach counseling Susan about adapting to life with a new ostomy? So I did bring some of those up as far as key points. Of course, diet, hygiene, and lifestyle changes. It can be very scary to go from an inside part of your body moving to the outside of your body. So I would tell her she does not have to tell anyone that she doesn't feel comfortable telling. Also, I would bring up intimacy because although she is 55, women of every age still are in intimate relationships, and I feel like that can be a very daunting part of having an ostomy. So I would tell her that she could return slowly to any intimate activity. Also, that she can return to work and physical activity whenever the physician gives her the okay. I'm going to go ahead and throw my reflection in here. After the simulation, I feel like it's not that challenging as far as ostomy care goes, just because mainly I've already encountered ostomy care as a CNA, and the part that I find particularly important is hygiene. You cannot stress this enough, just washing your hands. How would I apply the skills learned from the assignment to a real life patient encounter in clinical practice? So, one thing that I never thought of before as a CNA that I will have to think of as a nurse is how the patient will feel as far as how their life is going to change with an ostomy and stoma. So I would go over how to keep their quality of life as normal as possible, and go over like how it makes them feel, because I read a study saying a very high percentage of people who end up with ostomies end up suffering from anxiety or depression, and just because they are not educated well enough to understand that there are things like, if they're embarrassed, there are different types of bags to, say, cover it up. You could also wear undershirts to where you can't see it through your clothes. I know when my grandmother had her ostomy, she felt embarrassed, and I feel like she didn't get enough education to really help her feel any better. So I want to be able to bestow that upon my patients.